named by Paul Harris in the 1920s. And we're very, very honored tonight to have a really distinguished group of people on our panel. Some of the best looking people in New York, but also some of the most intelligent people. So there's a lot for us to learn from them. There are two big issues tonight we're going to address. One, the always ever present issue of COVID. And we're very honored and fortunate to have one of our very own members, Marya Ghazipura, Dr. Marya Ghazipura, and Rebecca Dissler. And let me just take this opportunity also to say thank you to the Global Shapers, who have been brought into the Rotary Club of New York, into our programs by our chair, Balor Chumurchador. And they have been absolutely dynamic every month. And they have a really outstanding group of young people. They're all part of the World Economic Forum, and they're all about change and making change in this world. So we're very honored to have them with us tonight, and Rebecca will be chairing that part of the meeting. The second part of the meeting deals with the unfortunate spate of anti-Asian racism, prejudice that we've been seeing in our country, across the country. Unfortunately, very present in New York City, as today's news unfortunately discloses. And the person who will be chairing that, the moderator, is Anna Tan, who will have a lot to say about this topic. And we are very fortunate to have Flora Fung, who is from the New York City Human Rights Commission. She's the East Asian Community Liaison. And we've invited Tim Wong from the Rotary Club of Chinatown. He will be on later on as well. Thank you so much for being with us. And I guess, Rebecca, I should hand, Laura, are you have anything you're going to say on this, or you want me to hand it directly to Rebecca?
None
Yeah.
will make an introduction.
Yeah, thank you, President Gerard, for your.
I apologize. Thank you. Anna Tan.
No problem, for your great introduction. And we're also very happy to collaborate with the Rotary Club. So maybe one logistical announcement. So during the session, please feel free to type your questions in the chat box, and there will be a Q&A session at the end of each part. There will be two parts. So, and also given the sensibility of today's topics, we highly encourage everyone to turn on your camera, to show your face, and we have an interactive discussion. And we aim to end by 8:20 p.m. So yeah, over to you, Rebecca.
Thank you so much. Good evening, everyone. I'm Rebecca Dissler. I'm the current curator of the Global Shapers New York Hub. It is such a pleasure to be here with you this evening. In many ways, from the moment the WHO, the World Health Organization, declared COVID-19 a pandemic, and perhaps even sooner than that, I think we have all eagerly awaited the development and availability of COVID-19 vaccines, a public health intervention that would help prevent deaths, but also help steer us toward regaining some sense of normalcy. Today, there are 3 COVID-19 vaccines approved and available in the United States, produced by Pfizer, Moderna, and Johnson & Johnson. And yet, rollout of these vaccines has been slow and often unequal. Certainly across countries, my work is quite global, but also across communities, and that includes within New York. And so as rollouts progress, our task ahead is not just about how we make vaccines available, but also how we bring them to communities and ultimately win the trust of communities and get those shots into arms. So today we're really here to talk about that last part, what we call vaccine uptake, where, how, or whether people choose to get a COVID-19 vaccine. And in many ways, I truly can't think of a better person to share her perspective on this important topic than Dr. Marya Ghazipura. She's an epidemiologist and biostatistician in New York City. For over a decade, she's worked in epidemiological consulting, in scientific advisory, guideline creation, evaluation, and she currently serves on New York City's COVID-19 Scientific Advisory Council to advise the mayor on the latest evidence in the evolution of the disease, as well as treatments and available vaccines. So Marya, thank you so much for joining us here this evening.
Happy to be here, Rebecca. Thank you for having me.
So what we wanted to do was, start with some context setting. So Marya, the vaccine rollout has been ongoing, and I was hoping that you could share a little bit about what the rollout has been to date, and what has uptake looked like, particularly in New York to date?
Yeah, so in most of the United States, including New York City, we've employed something called the ring strategy for vaccines. And that's just a way to inhibit the spread of a disease for people who are at higher risk. So think of it as a ring, hence the name, where the vaccine's in the middle, or the virus rather is in the middle. And right around it, we have these rings of people who are at highest risk. So in New York City, we started by vaccinating healthcare workers, frontline workers, then moving on to the elderly, and then those with pre-existing conditions, comorbidities, teachers and educators, simply due to their proximity to so many people. And now we're at a point in New York where anyone over the age of 30 can get vaccinated. In fact, next week, anyone over the age of 16 will be able to get vaccinated in New York. So that's a huge progress, and we've made some major strides. To really contextualize this, in New York, about 19% of New York City residents have been completely vaccinated, and 33% have received at least one dose. In terms of the US as a whole, we see about 16.4% have been fully vaccinated in our population. That's over 54 million Americans who've been vaccinated. And on top of that, when it comes to the high risk group, over 50%, so specifically 50.8% of every American over the age of 65 has been fully vaccinated. So that's really great. In fact, 74% of all people over 65 in the United States have received at least one vaccine. But we still have a long way to go. In terms of the state of the pandemic, in New York City and in New York State, rather, hospitalizations are at an uptick. They're slowly rising, not to the point where we're at major concern, but it's certainly concerning given the rate of vaccines and vaccine uptake. We have a lot of ICU admissions, about 903 as of yesterday, 500 intubations, so a lot of severe diseases, but of course nothing like it was last year. We're also seeing a disproportionate rate in other parts of the United States. Michigan is experiencing a very high rate of transmission. And to no surprise, Flint, Michigan is experiencing extremely high rates. They're also the area that have the second highest rate of some of the new variants that have entered the United States, which can explain why the rates are as high as they are as well. So when it comes to more of a global community, it's different country by country, where some countries are experiencing an uptick, other ones are on a downtrend, but those go up and down. And until we can get the entire population kind of on the same board, until we can start developing more of this sense of herd immunity, we're going to start experiencing our own ups and downs everywhere we go.
Thank you for that comprehensive overview. In many ways, what you've described does sound like incredible progress, but I'm really mindful that there are and will continue to be a lot of barriers to vaccine uptake. I'm wondering if from your work, you could share a little bit about what some of those barriers have been, particularly at a community level. And perhaps I'll even ask, not just what have they been to date, but what do you think some of the barriers will be moving forward and how some of those may change with the new updates and rollouts?
The most obvious barrier would be access to vaccines. Access has been an issue not just in the United States, but around the world. In the United States, they negotiated pricing for vaccines early, and they supported pharmaceutical companies. So they were able to get vaccines from Moderna and Pfizer earlier, and now we have Johnson & Johnson. Same thing with the UK, but other countries, and there is, the unfortunate reality that these vaccines are expensive. They took their time negotiating because the pricing wasn't quite what they needed it to be. So vaccines were a little bit slower to roll out. Some cities and some states, even within the United States, have more supplies than others. And likewise, some countries are at, a disproportionate advantage or disadvantage. Not to mention, when we are talking about these vaccines, a lot of them are mRNA vaccines, and there's the reality that storage is expensive, it's difficult. A lot of places simply can't store it. Even just in the United States, remote parts of the United States, people have to travel 2, 3, 4 hours to get a vaccine because storage is very difficult. They need certain temperatures, and a regular fridge can't handle those temperatures. That also means that they can only be shipped in small quantities at a time. So even when we look at major hospital systems in New York City, which have a lot of money and a lot of resources, they also are experiencing moments of, just not having appointments available. They don't have appointments available because it's hard to get the vaccines and get enough vaccines to have those appointments. So access is definitely a barrier that's happening now. It's going to be a barrier happening moving forward as well. But then there's also the other key issue, which is vaccine hesitancy. There's so many aspects and nuances to vaccine hesitancy. The first and most obvious one being misinformation. Let's face it, the vaccine was developed quickly, and mRNA technology seems rather new. And it's important to take a step back and really understand that fear. But I hope this session can help contextualize some of that for some of you. Well, first of all, the vaccines, they're not as new of a technology as you would think. We started studying this back in the 1980s for HIV, then again for Ebola. So it's been studied for decades, but they are expensive. And so, and when Ebola rates started declining in the United States, they kind of lost their luster. So they stopped studying it. For HIV, the focus was more towards treatments rather than vaccines, simply because of political issues at the time, as well as financial issues. There's misinformation about if mRNA can alter DNA. It can't. We inject something that gives you the code to produce the protein on top of the virus called the spike protein, and that's it. In 2 days, your body gets rid of it. There is no viral DNA being injected inside of you. It can't alter your DNA. And that sense of misinformation is what's being perpetuated, in addition to a very rational fear about the vaccines being developed within a year. The best way to describe this is when you think of cooking. So mRNA, we can produce that in a lab. That means we don't need to wait for cell cultures to grow. It's like waiting to grow your food on a farm will take a lot longer than grabbing ingredients from your fridge and cooking it on your stove. mRNA, we're just cooking it on the stove. We can produce it in a lab, which means we can rapidly manufacture it. Not to mention, these pharmaceutical companies had enough money and government support where they started manufacturing the vaccines in parallel with their trials. So they were willing to take on the financial risk of the trials, finding negative results, and that means their vaccines that they already produced would go to waste. So they were produced rapidly, but they were done so strategically and without cutting any corners. There's also this, in addition to misinformation about the science about the vaccine, there's this misinformation about whether or not you need the vaccine. A lot of people who are young and healthy, and I know we have a lot of young people on the call right now, there's this idea that you probably won't get sick. And it stems from the fact that statistically, people who are young and otherwise healthy tend to manifest disease either mildly or they're asymptomatic. So the first thing I want to say to that is, yeah, statistically, you're more likely than not to manifest mild or asymptomatic disease, but not necessarily the case. Mortality and hospitalization rates are lower, but people are still getting sick. A lot of people with no pre-existing conditions are dying, and we can't explain why. The number of patients we've seen in New York where, you have a mother and a daughter, a father and a son, parents in the hospital with their children, and their children are healthy and the parents are not, and the parents are the one who survive, and we don't know why. And we're able to control for the hospital and the treatment, but for some reason, the younger people are still dying. And even if you manifest disease asymptomatically, it doesn't mean that you're completely healthy. So they did a study on athletes in the United States who ended up getting the virus and were either asymptomatic or manifested mild disease. And they did an MRI and found that they'd had inflammatory changes in their heart. On top of that, they started reporting impaired physical performance that they're continuing to report 7, 8, 9 months down the line. And again, keep in mind, these are people who are likely healthier than most of us who are on this call right now. These are athletes, they're 19, 20, 18 years old. They're healthy, they're in tip-top shape, and they're still experiencing downstream issues to the point where in the United States and across the world, we're developing these research cohorts to go out and study these people because we expect that downstream, even if you're mild or asymptomatic now, there may be risk of fibrosis of the lungs in the future, and we just don't know. And we believe it's biologically plausible. So we're studying it, we're seeing if that can happen. So don't let this idea of mild to moderate disease fool you. But lastly, variants. If you're not vaccinated and you choose not to be vaccinated because you're willing to take this risk of mild to moderate disease regardless, keep in mind, you're opening yourself up to be a vector or a host for the virus. And the moment you're opening yourself up to be a host, you're giving the virus an opportunity to continue to replicate and mutate. Regardless of how you manifest disease, it will replicate and mutate inside you. So now what's going to happen is we're at a higher risk of producing a variant that is deadlier and that is more virulent than the ones we've already seen. We're luckily at a point right now where the dominant variants are more virulent, more transmissible, but they're not more deadly. That can change. If we keep giving it an opportunity to mutate in our bodies, that can change. We're giving it that chance to be more virulent, to be more deadly. And it can get to a point where it's more virulent and deadly and healthier in younger populations too. So it's important to realize all the nuances behind it. And the last thing I want to point out when it comes to a barrier is our history. Not just in the United States, but globally, we have an unfortunate history where minority communities have been targeted. Tuskegee wasn't that long ago. And I know we have a global audience here. So Tuskegee was a dark place in American history where syphilis treatments were being studied, and they targeted Black communities to study syphilis treatments without giving them informed consent. A lot of people who were part of these experiments are still alive today and are experiencing downstream physical effects from those treatments, from that experiment. Their grandkids, their children are alive, their communities are around. So people know about this. They mistrust in the government stems from our history. So this isn't really an issue any longer about misinformation as it is about the science of the vaccine. It's an idea of mistrust of those in power and a fear of this happening again. And that's probably one of the more difficult things to address, because you can't educate people simply on vaccine efficacy and safety and expect that to change their mind when there is such a deep-rooted history behind it. So, Rebecca, to answer your question, I know that wasn't a brief answer, but it's very nuanced and there are a lot of barriers involved.
Thank you, Marya. You have just here shown the power and importance of public health communications, being able to clearly communicate vaccines and their purpose and their efficacy, but also the myriad of challenges and uptake. Before I ask this next question, I do want to remind folks to please put questions that you have into the chat, and we will bring them into this session. Marya, I want to pick up on that last point you said around trust, and how might we go about building trust in the COVID-19 vaccines? And I'm curious if you could share that perspective. You touch on government and what government and perhaps the government of New York can do to promote trust. I would also encourage or would love your perspective on what we as a community or us on this call can do to help increase trust in the vaccines as well.
Yeah. So right now we're having massive campaigns to get people to really understand the safety and efficacy. And to really build confidence and understand everyone's fears around hesitancy as well. We're trying to focus on voices people trust. That comes from athletes, influencers, religious leaders, people in churches, and political leaders as well. One of our first attempts at taking a look at how to roll out vaccines in New York was to focus on low income and minority communities because the rates are so high. And then that's when we kind of learned our own lesson and had to take a step back when we were faced with backlash. And that's because of our history. Our history makes it problematic for us to address those communities with the vaccine first. It makes it seem like they're guinea pigs. So now the rollout has been more about an education platform from people they trust, from people in the community, from people outside the community. And also just political parties aligning, taking a step back. Not too long ago, we were talking about our elections and all of that. And there was this idea going around, or this narrative, that there's a push of one political party versus another. And there have been movements to unite political parties and aligning for one voice to push for vaccines and really depoliticizing this, making this a matter of health and not politics. And that's really important, especially now when we're so divided in the United States and even globally, we're so divided politically. And to start uniting one voice and one message, it's rather a new concept, but it seems to be an effective one. But also just seeing your friends, your family members, your peers, that personal experience. When we first look at vaccine numbers, when we look at surveys where we ask people, would you get the vaccine? A lot of people said no. And the moment people started getting vaccinated, someone who you personally know started getting vaccinated, it normalized it. It built confidence in its effects, and it made you feel comfortable getting it yourself. So what we can do as a community, especially a community of people who are young and educated, the key to targeting vaccine hesitancy is to build confidence within your knowledge base. So first, educate yourself. Pay attention to the emerging CDC guidelines. Pay attention to scientists and researchers. And don't just use social media as your main source of information. Everyone who's here today on this call, you're likely here because you have some sort of desire to learn something. So continue to do that. Continue to educate yourself and then educate others. You can only educate others, however, if you build trust with them. And you can't build that trust unless you can respect the reasons behind their mistrust. And so we can't fill those gaps of education unless you know what those gaps are. So hear them out, understand them, and then educate them. But lastly, if the vaccine is available to you, if you're eligible, get the vaccine yourself, lead by example. That personal experience has really helped people feel more confident and comfortable in getting the vaccine. Like I said, we're all vectors for this virus. Rebecca, you and I were talking about what to call today's session, and we arrived at the name of Us Against the Virus. And the reason for that is that's exactly where we are. It's a race of getting vaccinated before the virus can outrun us and form a variant that is so strong and so powerful that it's too virulent for us to catch up to and is far too deadly for our healthcare systems to handle. So we can all play a small part through educating our peers, our friends, hearing them out, really hear where their gaps of knowledge are and where their mistrust is coming from. That's the only way we can fill those gaps. But get vaccinated yourself, be that conduit in your community.
Absolutely. Marya, thank you so much for those sentiments and comments. I don't know if everyone else felt that sigh of relief in hearing your words and really understanding that we're all in this together. In our last few moments, I see some really good questions in the chat that I want to call out. So Malika would like to know, after 2 shots of the vaccine, are you still susceptible to the variants? And I should say that I will add a second one in here, that President Gerard was asking about the city's plans to open offices and schools, and advice that you may have for those on this call who may still be apprehensive about those openings. Perhaps we could weave those two together.
Of course. So the first part of the question, let's focus on opening up offices. So when we're opening up offices, it's our attempt at making things go back to normal. When we do start opening offices, the priority should be to continue wearing our masks. And I know that seems a little counterintuitive, but unless everyone in the office is vaccinated, we do need to continue wearing a mask because we can have the virus and we can still transmit it. It just means that we can't actually manifest disease if we're vaccinated. However, if most of us are vaccinated, we can start removing our masks and we don't need to social distance as much. Now let's talk about the variants on the other hand. Yeah, we can actually still get some of the variants. We're still figuring out the exact rate at which we can get some of the variants. You know, Pfizer, Moderna, all of these companies have published their efficacy rates. And, you know, they teeter between 94 to 95% for mild disease and 100% against severe disease and mortality. Those numbers go down, unfortunately, with some of these variants. Early numbers are projecting anywhere between 65 to 80%. So they're still great, they're still effective. But with that said, when it comes to severe disease and death, right now there has not been a single case that we know of an individual who has died from getting a variant when they have been vaccinated with Pfizer, Moderna, or Johnson & Johnson. I can't speak about the other vaccines, so I can't speak on them. But right now, we feel confident that you might manifest mild disease, but at least you won't wind up in the hospital or wind up, you know, unfortunately, with such a severe disease that you're at risk for death with the variant. Of course, that's assuming that the data remains consistent and that we don't get a variant that is so deadly. So, you know, get vaccinated. Social distance if you're not vaccinated yet. And if you're around people who are not vaccinated yet, just be mindful, be careful, wear your mask around them, wear your mask in public until we release further information.
Thank you. And perhaps one follow-up question on that, another great one here from Malika about questions around when the vaccines may become available for the under 18, or I guess it's under 16 population.
So they're actually running trials right now for individuals between the ages of 12 to 16. And our early data is showing that it's 100% effective for them, which is great. In terms of being able to actually get that approved, there's a huge process behind FDA approval, which I hope gives you some comfort. I know it's cumbersome because we have to wait, but I hope that gives you some confidence and comfort in our system to get FDA approval. You know, I've done a lot of work for drugs to get FDA approval for them. It is a process. So it will take a little bit of time. And of course, because of the nature of the pandemic, they are prioritizing anything COVID-19 related. But they will be submitting approval and likely soon. I wish I could give you a date, but preliminary data is fantastic. Stay tuned. But right now, the best thing we can do is if you are eligible, you can get vaccinated now. And hopefully in the next few months, as early as then, we can start vaccinating people 12 to 16 as well.
Excellent. And perhaps one final question from the chat here, just to extrapolate from President Gerard's remarks. A really good question in here around, and this I think goes back to the comments you made earlier around young people, you know, certain earlier messaging in the pandemic that young people weren't as susceptible, how that narrative is being challenged by the data. And so, you know, we do see young people traveling. We do see young people, you know, eager to get back into very socially active lives. Any kind of parting words for a truly a mixed crowd of generations here of how we can collectively reach young people with really important messaging, certainly around the vaccine, but also around continuing to do their part in helping us end the pandemic?
Yeah, so the messaging for that is, you know, a lot of these people may manifest disease as mild to asymptomatic. You know, it goes back to that same story where there's not a lot of fear because they're comfortable with that risk. But that risk can have a lot of downstream effects. Like I mentioned, those athletes, they're a lot healthier than a lot of the people at these parties, and they're experiencing issues in their performance that will impact their future entirely. They're experiencing inflammatory changes in their lungs. Not to mention the fact that we're allowing the virus to continue to mutate and form those variants. So we need to be mindful. And also be careful when you're interpreting data that's going to be on the news. A lot of people are wondering, well, people are partying in Florida, but Florida rates aren't going up. people are partying in Florida because they're coming from other states. Now they're taking it back and dispersing back to their individual states. So we have 50 states in the United States. They're going back to 49 other states potentially. So those rates are dispersed throughout. And Florida, yes, they're going to experience a small uptick that is analogous to that of the United States because everyone's going back to their states. So don't let that narrative that's being perpetuated that Florida is not experiencing an increase to confound your perception of what's actually happening. So the important thing is stay educated, stay informed. I know we all want to go back to our lives, so get vaccinated. You know, at least when we're vaccinated, we can start feeling comfortable around those who are also vaccinated, start seeing our families or parents and feel comfortable knowing we're not putting others at risk and we're not contributing to, you know, a prolonged global pandemic.
Absolutely. I know I am not the only one on here very much looking forward to hugging a loved one very, very soon. Marya, thank you so much for your time this evening and for your comments. And to everyone on the call, thank you for listening in and being part of this conversation with us.
Thank you, Rebecca.
Excellent. So with that, it is my great honor to turn the conversation over to an incredibly important topic, certainly the rise of